So good morning, everyone. First of all, I want to thank the organizers for giving me the time to talk about dengue and how we as a company are exploring novel collaborations and partnerships to advance, in this particular case, specific novel compounds against dengue virus. And I will also explain a little bit more on how this resides in Janssen's or Johnson & Johnson's commitment to global public health. So basically, throughout this commitment towards global public health diseases, it's Johnson & Johnson's who is aspiring to deliver innovative solutions to tackle complex global public health issues. And we want to do that to empower families and communities to create healthier futures on the long term. And how we want to do that? By making life-changing, long-lasting differences and impact for human health. And therefore, we are really collaborating with different partners and global partners and also those closest to the local needs, where we try to collaborate in an entrepreneurial spirit, combining it with the capabilities of big pharma companies like our Johnson & Johnson company. So, just a few more words about our recently new organization, so Global Public Health within Johnson & Johnson. And the mission is clear and simple for global public health. We want to address and solve all the important unmet medical needs that are currently out there and are a threat for all the patients and people living in tropical and subtropical regions of the world. And we want to do that by building on our strong legacy of innovation and also based on our dedication to improve the global public health. And this is built on 4 important pillars. The first one is really research and development. We really want to study neglected diseases, but also diseases which have a disproportional impact on public health. So meaning diseases that in the rich countries are far less important compared to in the developing countries. Next to that, the second pillar is really sustainable and affordable access for our medicines. Based on these approaches, we want to get our medicines everywhere in the world so that every patient has right, because we believe that every patient has the right to get access and good care to the medications. Furthermore, we want to collaborate with partners in innovative ways in a way to improve the health outcomes, not only from individuals, but also families and community in general. And finally, we also strive towards education and prevention, because we want to empower the next generation of healthcare workers to spread the word on disease prevention, and not only helping other people, but also making communities aware how they can prevent infectious diseases. Now, within global public health, we have really 3 focus areas. First of all, we want to end preventable maternal and newborn death, and we would like to enable children to thrive without any worries. Next to that, we have HIV/AIDS. We really strive to the fact that every baby is born HIV-free, and those people living with HIV have access to simplified treatments and care. And finally, we're also heavily investing in tuberculosis. We really want to eliminate extreme drug resistance and multi-drug resistant TB related mortality, and also simplify the treatment regimen, because nowadays treating TB is a very complex manner. Now, it's especially on HIV and TB that laid the foundation for us to build this new global public health organization. However, we're constantly and actively looking for novel opportunities to have, including game-changing technologies. And we are looking, for example, the development of the Ebola vaccine. In this case, I will go in today a little bit more on dengue virus, but we're also looking at Chagas, lepra, and worms-related diseases as well. So, what about dengue? You heard already a nice introduction by the previous speaker. So, the dengue program was transmitted by the end of last year to our Global Public Health organization, and this opened up the opportunity for us to really collaborate with a lot of partners throughout the world to move the development of our compound forward. So, and that's been highlighted before, half of the planet is at risk of becoming infected with dengue virus. Not only people living in the tropical and the subtropical regions, but also more and more people living in the US and Europe, for example, as cases have been detected in the south of France and Italy, for example. Typically, we have 400 million infections every year, which results in 100 million symptomatic infections and approximately 500,000 hospitalizations due to severe dengue cases. And unfortunately, we still have to deal with around 25,000 deaths on an annual basis. More importantly, dengue is also among one of the leading causes for child hospitalization and death among children in Asia and Latin America, and it really has a significant impact on the healthcare systems as well on the economy as well. So, how are we as Johnson & Johnson, and now more specifically within the Organization of Global Public Health, dealing with the development of small molecules for dengue? Well, we partner. And in this particular case, we started a collaboration with the University of Leuven, who in turn were sponsored by the Wellcome Trust to look for new opportunities for dengue. And the mission here is also quite simple. We want to have the first-in-class antiviral small molecule for not only the treatment, for the treatment and of the prevention of travelers towards endemic regions or also communities living in dengue endemic regions. And therefore, I think this collaboration really is a typical example of how academia and big industry can collaborate, because in the first couple of years, together with Wellcome Trust, the University of Leuven invest quite a lot of research in target identification and identifying initial hits from small high-throughput screening efforts to detect initial starting point for small molecule development towards dengue. And since 2013, we joined our efforts, we combined our efforts, where we jointly develop now the small molecule program. And I really have to say, by combining academia with industry, not only by combining chemistry, but biology as well as other functions within the preclinical development, both partners can do together much more than we could have done each on our own. First of all, academia doesn't have all the resources and access to all the development platforms. On the other hand, we need to be fair. Within big pharma as well, there is constant constant pressure to develop small molecules, and neglected diseases are heavily under pressure compared to other, from a company perspective and from a shareholders' perspective, more important diseases. However, through this organization, again, we really can focus now on neglected tropical diseases. A second collaboration that we have is really working together with small companies that resides in the dengue endemic countries. And in this case, we have a collaboration with Brim Biotechnology, which is a Taiwanese company. And in the end of 2015, we really signed up an agreement to do a research collaboration and an option and a license agreement to really develop new treatments against dengue. And in this case, we really leverage Janssen's experience for infectious diseases and the research units that we have, combining them with Brim's core capacities on translational science and integrated operation management, specifically in Asia. And this is compared to the previous, a totally different kind of collaboration where we seek help from the other partners to co-develop small molecules. So, and for this presentation, I just want to end with one important message. Overall, our goal is really to actively help to build healthy communities worldwide throughout innovative and impactful healthcare solutions and partnerships. And specifically for dengue, let's join our forces and stop dengue, because we believe that developing small molecules together with vaccines and vector control, I needed to use that word once in my presentation, and maybe other solutions as well, we really want to fight together and stop dengue and maybe other flyviruses as well. And for the last 30 seconds of my speech, I really want to reach out to all of you because we're really keen on collaborating. We have lots of unanswered questions for our development as well, going from epidemiology studies, economic burden studies, having access to data, having access to people working locally in endemic regions. That's really where we are keen on to collaborate. And also, please feel free to reach out to after the presentation and during the day to me, but also to my colleague Francis. So both of us are approachable, I would say, and we're open for discussion. So thank you very much for your time.